and welcome back to Billing Insights, your favorite podcast for medical billing. I'm Taylor.
And I'm Anita.
And we are still stuck outside of the office due to the 200 gallons of water that fell through the ceiling. So, we're still recording in this format for now. Hopefully that's fine with you, but you do need this very important information, vital to your everyday life. So,
very much so.
This is part 2 of our credentialing versus contracting video. And like Anita said in the last video, we are going to be going over the different types of paperwork that come along with the credentialing process. Let's start off with, what is a DEA?
So a DEA is a federal license that allows a provider to prescribe and administer controlled substances, things like narcotics. So that allows you to do it a national certification or a national license. But you also, in order to be able to prescribe, you need a state license, and that is called a CDS, that allows a provider to prescribe and administer controlled substances. But the name does vary a little bit from state to state. So just for example, Missouri has what's called a BNDD, and that's issued from the Board of Healing Arts. And Indiana has what's called a CSR. So just be aware, it varies a little bit from state to state, but you still need that specific license for that state.
Correct. And we also have boards, which are voluntary documentation that qualifies a provider to practice their chosen field, like internal medicine, pain management, ophthalmology, etc. It's also used to refer physicians for evaluation if necessary.
So in addition to that, you would have a professional liability insurance. That insurance allows a provider who obtains it to cover them in case of being charged with malpractice. It's specifically used for individual providers, and it just protects them in case of a lawsuit.
And then on the flip side of that, or not really the flip side, but in relation to, you have general liability insurance or comprehensive liability insurance. And that is insurance that a clinic obtains that covers them in the case of accident on their premises, specifically for their building/property.
So you're going to hear us, at least from our purposes, whenever we're asking for documentation, you're going to hear us asking for your professional liability insurance. When we ask for that, we are asking for something different than when we're asking for your general liability insurance. Now, some providers may get it from the same place, but it should be two separate pieces of paper.
Right. And then one that you're going to hear a lot, and one that insurances are going to deny and request, is a W-9. I'm sure you've heard of a W-2 or a W-4 if you've ever worked before. I'm sure you've heard of at least one of those. The W-9 is a tax document that details the name that will be listed for the IRS, as well as the tax ID being used for that clinic.
Now, it's really important that whenever that provider fills out the W-9, that it lists the name exactly the way it's on your IRS documentation. If you have a missing LLC or a period or a dot in the wrong position, they will not accept it.
Right, and speaking of the IRS, there are IRS letters, which are documents detailing exactly how the provider is listed in the IRS. And this can be a useful tool in identifying exactly how a W-9 needs filled out or what address is on file. And when you're doing all of your credentialing, if there's a doctor with like a hyphenated name, or the organization name has a bunch of extra stuff in it, and you're wondering, do I need to use the DBA? Do I need to use this? Do I need to use that? How do I put our name on the paperwork? Always, always, always match the IRS letters.
And match it exactly.
To the T, to the period, to the hyphen, to the PhD at the end.
Yep. So the next is a CV, and that's a Latin name. It's Curriculum Vitae. It's a long document similar to a resume that lists the details of the entire career of the provider from college on. And when they say college, what they're wanting to know is, as soon as you graduated, why is there a gap of 9 months from the time you graduated till the time you started? And you're going to have to detail exactly what went on. And if there's any gaps between whenever you were hired at one place and you stopped and then you were hired at the next place, they're going to want explanations of why that was.
Exactly. So that is the first half of our common credentialing paperwork. We
Hmm.
may have another document coming up here. Let's see.
Yes, we do.
Oh, we are moving on to CLIA, which has 5 different levels.
Yes.
So CLIA, that stands for Clinical Laboratory. What's the I and the A?
Hmm. Good
Good
question.
question. Please hold while we try to connect you with Google. CLIA stands for Clinical Laboratory Improvement Amendments. And the CLIA is something that you need if you want to be able to do different types of tests. So CLIA is assigned to the group, not the individual provider. It allows providers within the group to perform labs in office. The regulatory requirements of CLIA vary based on the types of tests or laboratory tests that the laboratory performs. CLIA regulatory requirements classify testing into 3 categories: high complexity, moderate complexity, and waived. And there is a modifier, which we can talk to you about on Modifier Monday,
Yes.
that represents CLIA waived. But there are 5 different types of certifications. Each is generally effective for 2 years. Most of the providers that we have here, Gateway, are level 1, meaning they only do the CLIA waived tests, which is listed on the CMS website. Mom, if you want to go into level 1.
So, excuse me, a CLIA waived test is something that it's waived from needing a CLIA number, except you actually do still have to register and get this waived paperwork. So it's still almost as if you need it anyways, so it's just silly. There are quite a few tests that a provider can do in office that are called point of care testing. So things like a urine dipstick test to see if a person has sugar in their urine. A flu swab test to make sure that the patient has or does not have flu.
RSV, strep,
Mhm.
COVID.
um, Checking for blood in your urine, or sorry, not in your urine, in your stool. Those kinds of things might need a CLIA waived. And what we do is we put a modifier on it to show that we are not required to have that CLIA certification, although we do have the paperwork to show that we're allowed to be CLIA waived.
Right. So level 1 is certificate for performed provider microscopy procedures, or PPM procedures.
Mhm.
Level 2 is the certificate of compliance, and that's issued to a laboratory after a CMS surveyor or state agency has conducted an inspection and determined the laboratory to be compliant with applicable CLIA requirements. Then we have level 3, certificate of accreditation, or COA. And these certificates are issued to the laboratory based on its endorsement by a CMS authorized accrediting organization. If at any point you have something to say about these, just jump in.
Okay.
But level 4 is certificate of registration, and that allows us a laboratory to continue performing high complexity and or moderate testing until it is inspected and evaluated for its
Mhm.
compliance with CLIA regulations.
So
And
it's kind of a
only
provisional registration, and it could last for several months because, especially during COVID, the labs got really behind in having the inspectors be able to come out. So we had one provider who had a certificate of registration for about 6 to 9 months. It was a very long time before they were finally able to make it out and do an inspection and approve him.
Right. And so at this point, we are going to snip the video here, and I will be right back. Hey, we're back after a short break. So certificate of waiver is level 5. And the CLIA guidelines define waived tests as those that can be categorized as simple laboratory examinations and procedures that have an insignificant risk of an erroneous result. A laboratory may qualify for a certificate of waiver if it only conducts tests that pose no harm or risk if performed incorrectly, employ
Methodologies.
methodologies that are so simple as to render the likelihood of erroneous results negligible, and are cleared for home use by the U.S. FDA.
Mhm.
These types of tests include ovulation tests, urine pregnancy tests, and blood glucose tests via glucose monitoring devices approved by the FDA for home use. The complete list of waived tests sorted by
Analyte.
analyte name can be found on the FDA website.
So they're saying that if you did something wrong, it would probably not harm the patient. There's very insignificant risk of that. But they're so easy to do that they don't expect that you're ever going to do anything wrong. So like for a urine screen that we talked about, checking for sugar in the urine, what you do is you dip a little stick that has color coding on it, and you match the colors to the color codes on the side of the bottle that you pull the stick from after you dip it into the patient's urine. So you might have yellow, green, blue, orange, whatever colors. And it says if this color matches that color, then that means, yes, they have sugar in their urine. If it matches this other color, they may have less amounts of sugar. And if it doesn't have it at all, there's no sugar. So it's really easy to match the colors to what results that you're looking for. And of course, a urine pregnancy test, if you've got a positive or a negative, really simple to tell whether the patient is pregnant or not. So
Definitely. So, if you have any questions regarding CLIA, please feel free to leave that in the comments below. Otherwise, we're going to move on to void checks and bank letters. And they're just used to tell insurances exactly where they should send payments. And it should include the bank name, bank address, account number, routing number, account holder's name, and account holder's address.
Make sure that someone that's an officer at the bank signs the bank letter, because if it's not signed, they're not going to accept it.
Much like your note, you should always sign your note. If you want to know more about that, go watch our other video, How to Sign Your Note Like a Goat, on Billing Insights. So, there's also the Educational Commission for Foreign Medical Graduates, or the ECFMG. And it is a number used to identify if a provider has completed their training in a country other than the United States of America. This is something that our credentialing department very rarely needs, as most of our providers are U.S. citizens. But if you, not U.S. citizens. Oh no, did I mess that up?
U.S. providers or were trained in the U.S. If you have
Right.
a provider, for
Training.
instance,
You can be a
who
U.S. citizen, go over to London, and then come back. Okay,
Right.
yeah. So that is something that we rarely need because most of our providers do all of their training in the United States. But if you do want to study abroad, just know that you will need to get that number and provide that to your billing company or your in-house biller, or your credentialing company if you want to get a company that only focuses on credentialing. But you will need to have that.
So next is, how do you know you're a new credentialer and you're hired to do credentialing for your provider? How do you know if a provider is in network with an insurance, or if they're out of network, or if they've never had anything at all with an insurance? The first way, I think we talked about this yesterday, is checking the directory, and you can just Google a provider who has Aetna. Find my Aetna provider and see if they show it up listing on the portal that you're looking through. If it shows that that provider is there, then they're in network. But you have to be really, really careful to make sure that you check for the correct service address, because providers who add new locations or just go and join a different group or something like that might be credentialed and in network with one address, but not with another. And you still may need to do some credentialing there. If you have any questions, just reach out to your provider contact with the insurance and, let them know that you're checking to see if a provider's in network. And also, really important, make sure that when they're looking it up, that they're checking for the correct tax ID. And we always recommend that they tell us what tax ID that they're looking under whenever they say a provider's in network, so that you can match it to make sure that it's correct.
Right. And along those same lines, how do I look up a provider or group's taxonomy code? We pretty much covered that in the last video.
Mm-hmm.
But I'm just going to group it together with the other one. So NPPES, MPI registry, you can actually watch me physically look it up in the other video.
Mm-hmm.
But you can use the provider's individual MPI if you're looking for the taxonomy, or the group MPI if you're looking for the group's taxonomy, but that's the easiest way to find a taxonomy code online. So let's move on into what phone number or address should you use. So for a lot of people get confused because a lot of these terms get used interchangeably,
Mm-hmm.
but if they're asking for the billing address or the practice location or not, okay, if they're asking for the practice location or the service address or the physical location, that is the location of which the services are provided. If they're
Correct.
asking for a remit address, a billing address, a mailing address, that's quite often a PO box. It doesn't have to be. It's just wherever the provider wants their mail to be delivered. Some providers may want that delivered to their house. Some may want it delivered to the clinic or the hospital that they're providing the services at.
Or a
And
lockbox.
a lockbox, or most commonly, I see providers wanting it sent to a PO box. So you want to make sure that you have all of that correct. And then for phone numbers, it depends on if they are wanting the provider's office's phone number, or if they are wanting a phone number for who is in charge of credentialing, or do they
Mm-hmm.
want the office manager's phone number. So really make sure that you're reading the details and paying attention to see what verbiage are they using and which one you should use.
So moving on, then we're looking at you're looking at doing credentialing for your providers. You need to know what sort of providers there are to be able to be credentialed and where they might practice at. So the first one we want to talk about are locum tenens. Those are providers who fill in for other providers on a temporary basis, usually 6 weeks or less, and they are not credentialed. There's a modifier, which we will cover on a different modifier Monday, but that you would show you bill under the physician who's there all the time, and you put a modifier on the claim and show the NPI so that they know that this physician is covering for the normal physician who's always there.
The physician's name and title and NPI in box 19.
Yes.
So we also need to talk about participating and non-participating providers. So participating means that they're in network. Non-participating, or more frequently you might see it called non-par, because that's a long name, is out-of-network providers. So to help you save money, most health plans provide access to a network of doctors, facilities, and pharmacies. These doctors and facilities must meet certain credentialing requirements and agree to accept a discounted rate for covered services under the health plan in order to be part of the network. These healthcare providers are considered in-network. If a doctor or facility has no contract with your health plan, they're considered out of network and can charge you full price. So last episode, how we said that you do the credentialing first and then you can start contracting, out of network providers never did the contracting part. They stopped at credentialing. And it's usually much higher than the in-network discounted rate.
For the patients, absolutely.
Yes.
Yeah.
So then we also go into hospital versus hospital based, if you want to take that segment.
Sure. A hospitalist is a provider who only treats hospitalized patients. But a hospital-based provider is someone who may have a clinic whose main treatments are generally performed within the hospital setting, but they also see patients in a clinic. So they're hospital-based, but they're not exclusive to the hospital. For contracting purposes, when the insurances are looking at, how much we're going to pay for this CPT code or, reimburse for that type of situation, they're usually considered the same, but again, they're a little bit different as to how much time they spend in the hospital.
So what is next on the list? We have inpatient versus outpatient. So inpatient is anyone admitted into a hospital. Outpatient is care that does not require hospitalization. And you may be wondering, how does this relate to credentialing? A lot of applications ask what type of services you're providing or what your location is. And it's just important to know these terms when you're speaking with those representatives.
So an individual versus a group. An individual person is just that specific person, that specific provider. Really important to remember that an individual NPI is different from a group NPI. So you need to make sure they're not interchangeable and make sure that you put those numbers in correctly whenever you're filling out your form.
And I believe Anita said in the last video, but you can be an individual with no other providers in your group and have
Yes.
a group. It just makes it easier to add people into your group after the fact.
Correct.
So we did individual versus group. Now group versus facility. So the group, several providers belonging to the same organization or providing similar content or function are part of a mechanism for organizing and simplifying the registration of providers. Facility, that's going to be like a hospital, a nursing home, but it's an institution or entity licensed where required to provide care. So when you're talking about billing, if you're billing for a specific group of providers, you're billing for those providers' time and the services they provide. But if the patient's getting seen at a facility, they're going to have the bill from the provider and also the bill from the facility. If you had to stay in the hospital had to provide you a room, which has electricity and water. It has a bed. It has bed sheets. They provide all of the medical supplies that the doctor may use. Gloves, band-aids, literally anything that the provider doesn't charge for, that the provider doesn't pay for themselves, the facility is going to bill for.
So one of the things that we wanted to kind of make a distinction here, if you have a provider who's going to be working for a hospital or something like that, and they have either a PHO or an IPA, you're going to be in luck because a lot of your credentialing will be done by this hospital and make your life a whole lot easier. Of course, they don't generally credential for every single insurance, but a big portion of them are usually done. So let's talk about what's the difference between an IPA and what's the difference between a PHO.
All right. One more emergency. Snip. I'll be right back. Okay, so I am back now. Where did we leave off?
IPA versus PHO, and what's the difference between the two?
Okay, so a PHO or a physician hospital organization as well as the IPA, Independent Physician Association. They're both organizations within medical facilities, such as hospitals, that take over the credentialing of doctors for the specific plans that they offer. And these plans differ from one hospital to another. So the PHO or the IPA, they have a list of plans that the hospital wants the providers to be in network with, and they make sure to get them in network with all of those plans. You can reach out to the PHO and ask them questions if you would like. They do have contacts available for that. You can request that they add a new plan. Doesn't mean that they're going to. But you can definitely reach out and request that. And then anything that isn't covered under the PHO or the IPA, you can submit credentialing information yourself for. But anything handled by them needs to be handled by them.
Right.
I think it is very important to address the topic of PTANs. So when you get in network with Medicare, you will be assigned a Medicare PTAN, which is an identification number that's unique to a provider for Medicare's purposes. And they are going to want that to be attached on the claim. And you know what? Take it away. We've had so many emergencies today. I have to keep answering calls.
Right.
There's aside from the 200 gallons of water that dumped on the office, we also had over half an inch of ice and then a bunch of sleet
about
and
3 inches
snow
of sleet, and then about 2 inches
put
of snow on top of that.
And then last night, it started snowing again, and I think it only stopped about an hour ago. And I had a member of my household who decided to go out into that, and it just causes me worry. I need to answer the phone.
It's been interesting for sure.
Yes.
So a couple of miscellaneous items. Taylor had mentioned the PTAN, that's a provider transaction number. You would have one for your group and for your individual provider. You can use that for things like getting credentialed, of course, but if you're calling the IVR line, which is an interactive voice response line, you can check, to see if Medicare has issued a check. You can check claim numbers to see if a claim is being processed or denied. You can check eligibility, just various things with that. And anytime you call with a question to Medicare, which they do have a very helpful line if you have questions about why your claim denied, the first thing they're going to ask you is what's your PTAN, what's your NPI, and what's your tax ID. So you'll need to have all of that information readily available before you call. So again, very important numbers. And then just some miscellaneous things to know. You could be in network with Anthem, for instance. And Anthem is kind of a broad umbrella, and several other insurances are the same, like Cigna and Aetna, where there's a bunch of little tiny plans underneath those insurances. You have to make sure to get a list of those plans because there's so many. You don't know if you're going to be in network with one of the little ones, but out of network with one of the other little ones. So just make sure that you request as much as you can and then ask them for a list of everything to make sure that you're in. And then also be aware, insurances add new plans all the time. And if they do, you have to be sure to apply for those new plans because a patient can say, I have Anthem, and you think, oh, we're fine. And whenever you come in, it's got an Anthem Silver Blue plan that you're not, or a Healthy Blue plan that you're not in network with.
So I think that pretty much, wait, did we talk about Medicare Railroad having a PTAN?
We did not, and that's completely separate from regular Medicare. It's for retired Medicare Railroad employees, and it gets credentialed through a completely different Medicare JMAC. So make sure that you're aware of that. If you do have a Medicare Railroad plan, they can get in fairly quickly, but you do have to request that separately. One thing I did want to mention that you are probably going to hear is collaborative agreements. Now, a collaborative agreement is something that you have as a nurse practitioner or a physician's assistant. It's a document between the provider and the advanced practice nurse. It kind of goes over the responsibilities, what the supervising physician has to do, as well as what the nurse practitioner has to do. And it kind of protects both the nurse practitioner and the physician. If something bad were to happen to a patient, then, who is responsible for oversight and who, would be legally responsible if something were to happen.
Right. So I think that pretty much sums up everything that we wanted to touch on with this two-part segment for credentialing versus contracting and everything you need to know about it. Of course, there are always going to be questions because there is just so much to deal with here.
For
So
sure.
whatever you're most interested in knowing more about, please let us know in the comments so we can get another video put out for you and help educate everybody further.
And anytime you have a question, if you want to ask us or if you want us to do your credentialing, we are always here. We're ready to help. We have an onboarding team that will assist you. And of course, we have a credentialing department. Again, like I said yesterday, that's all they do all day long is work on credentialing for new locations, new providers, new facilities, new ASCs, new pretty much anything.
And how cool would it be to say that I have a billing company who does credentialing and podcasts? I mean, really. You can't get more transparent than that. So, thank you guys so much for watching. We loved having you here. We really appreciate your support. Don't forget to check us out at gmslearningacademy.com. That's G as in golf, M as in Mike, S as in Sierra, learningacademy.com, where we not only upload our podcasts like we have here, but we also upload courses that you will be able to take. They're not uploaded yet, but they will be, so please check it out. Please remember to like, comment, and subscribe, as well as press that notification bell button so you can be notified every time we upload new content, and you can stay up to date in this ever-changing industry. So again, thank you, and we'll see you in the next video. Bye!
Bye!